Patients already with cirrhosis must not discontinue medication, because once medication is stopped, the chance of liver failure is very high after a relapse. Hello, I'm Dr. Yu Yucha. Welcome Professor Yu Ming-Lung to Care Online. Hello, I'm Dr. Yu Ming-Lung. How should medications for hepatitis B be chosen? The first category is interferon. Its advantage is that the treatment lasts for half a year to a year, with a fixed course. The downside is the presence of side effects, and it requires injections. Generally, for individuals around 30 to 40 years old, who can tolerate the side effects, especially if planning to conceive, when using oral antiviral drugs, pregnancy may not be advisable. If a young person plans to conceive, when planning for pregnancy, they can use interferon before that, with a fixed course of treatment, ending it as planned before conceiving. This is interferon. However, its drawback lies in its effectiveness, which is only around 30%, and it becomes ineffective after a year. The advantage of oral antiviral drugs is 1 pill a day, with minimal side effects, but the course is uncertain, ranging from 3 years to a lifetime. Some oral antiviral drugs are not suitable during pregnancy for older individuals no longer planning to conceive. If the severity of the disease has progressed significantly, such as in the case of liver cirrhosis, or even liver failure, interferon cannot be used. Only oral antiviral medications are suitable. In such situations, it primarily depends on 2 factors. Is there a plan for childbirth? How severe is the disease? When can the treatment for hepatitis B be stopped? In interferon treatment, it has a fixed course, lasting for half a year or a year, and then it must be stopped. However, for oral antiviral drugs, it's uncertain, at least 3 years, and possibly a lifetime, when to stop medication. It depends on 2 main categories. One is for patients who should not discontinue medication, called those with cirrhosis, as stopping medication increases the risk of liver failure after a relapse. If there is no cirrhosis, and the patient is in fibrosis stages 0 to 3, consideration can be given to stopping medication. According to the guidelines of the Asian Pacific Association for the Study of the Liver and the Taiwan Association for the Study of the Liver, it is divided into e-antigen positive and e-antigen negative. Regardless of e-antigen positivity or negativity, there is a specific characteristic, the response of the virus and liver index to the treatment, and after reaching a certain point, continuing for another year for consolidation, medication can be considered for discontinuation. What is the target point? For e-antigen positive patients, reaching e-antigen negativity, e-antibodies appearing, and normal liver indices, after meeting these conditions, after these 2 conditions, and completing a year of consolidation therapy, medication can be considered for discontinuation. For patients who originally tested negative for the antigen, must have normal liver function indices. The virus in the blood must be undetectable after at least 6 months, meeting these criteria again, followed by a 1-year consolidation therapy. Only then can discontinuation of medication be considered. These 2 criteria are crucial. Currently, when discussing the possibility of discontinuing oral antiviral medication, firstly, it depends on whether there is liver cirrhosis. Secondly, it depends on whether the e-antigen is positive or negative. Thirdly, it depends on whether the criteria for discontinuation have been met. What should be noted after stopping medication? Currently covered by National Health Insurance, some patients are covered for 3 years, and they must stop medication after 3 years. After stopping medication, some patients will progress very well, with continuous normal liver indices and detectable virus, and eventually the disappearance of antigens, achieving the goal of eradication. However, this is only a small fraction. After stopping medication, more than half of the patients experience a viral relapse. More than half of these patients, after a viral relapse, may develop chronic active hepatitis, or even, as recently discovered, liver failure. Emphasized again that stopping medication for hepatitis B is not without consequences. Regular follow-up is necessary, especially in the first 6 months after stopping medication. Scheduled follow-ups are crucial. Any discomfort or dark urine, should prompt a quick return for a checkup, as more than half of patients may relapse. Special attention must be paid. What does the future hold for hepatitis B treatment? The new therapeutic approaches can be divided into two main categories. The first category closely resembles current oral antiviral medications, primarily targeting the viral replication process, aiming to interrupt its replication. This includes stages from the viral infection and assembly processes, viral nucleic acid replication, to the entire gene expression process of the virus. The objective is to disrupt these stages. However, up to this point, except for the known oral antiviral drugs, other approaches have not yielded success. The second category involves enhancing the body's immune capability, similar to interferon. Most of them are administered orally, while some are injectable, which include immune enhancers, and even contemporary immunotherapies. To explore new possibilities, another is therapeutic vaccines, which are currently being actively developed, with the hope that therapeutic vaccines can boost the body's immune response. These two categories are currently in development. However, it appears that the likelihood of success for a single treatment target is relatively low. In the future, it may trend toward combination therapy, similar to hepatitis C, integrating different mechanisms to increase the chances of eradicating hepatitis B. About 20 years ago, when I first joined this team, we started community screenings and free clinics. It was the first time we brought ultrasound outside of the hospital. We gathered all colleagues in the department, 12 doctors, 10 ultrasounds, and conducted a day of 1,000 free ultrasounds in Ziguan Township. At that time, I had just been promoted to attending physician. The impression was very profound. Besides many cases of hepatitis C, there were also many hepatitis B cases, similar to the prevalence in the entire Taiwan, around 10 to 12%. What surprised me was that just by doing this for one day, we found 2 cases of hepatocellular carcinoma. These 2 patients, one of them is diagnosed with hepatitis C, while the other has hepatitis B. The patient with hepatitis B was aware of his hepatitis B infection. However, he didn't follow up. He decided to have an ultrasound because we were offering free screenings. As a result, LIVER cancer was discovered. Over the past 20 years, we have been promoting community screenings and free clinics. The most important thing is to raise awareness of hepatitis B among the public. Everyone is born in this country should know if they are carriers. In theory, early treatment and prevention of hepatitis B are possible. Once again, I urge, if you haven't been screened for hepatitis B or hepatitis C, take advantage of the government-subsidized, completely free, once-in-a-lifetime hepatitis B screening. Any medical institution can perform it. You should promptly get tested. Thank you, Dr. Yu, for joining us at Care Online. See you next time. Bye-bye. Bye-bye.